Welcome, everyone, to our public safety briefing today. I'm going to start with some opening remarks and then introduce our speakers, and we'll hear from 3 different agencies today. As we know, the COVID-19 pandemic had many impacts beyond the impacts on our health. And one of the most concerning impacts has been the elevated levels of violence across the country, including here in our community. In Madison, we have worked hard, collaborating across many departments to tackle these issues, taking a data-informed approach and engaging in strategic planning and targeted interventions in multiple ways. We made unprecedented investments in affordable housing and rental assistance, in youth employment, in mental health crisis response, in homeless services, and in a public health approach to violence prevention over the past few years. We did this because I, our residents, and our Common Council believe that our city is stronger when our people are adequately supported. Today, you'll hear from Public Health Madison-Dane County about their community-driven work on violence prevention. You'll hear the results from the first year of service of the Madison Cares program, our mental health crisis response service, which is staffed by paramedics and crisis workers. And you'll hear the results from the Madison Police Department's summer strategic plan to target and reduce gun violence in our community. Together, these departments are taking what I call a team city approach to building strong, safe neighborhoods and a better Madison. These efforts are paying off, and the trend lines are looking good, as you will see. First up is Arielle Smith, Director of Policy Planning and Evaluation at Public Health Madison and Dane County. She'll be followed by Che Stedman, Assistant Chief of Medical Affairs at the Madison Fire Department. And finally, you'll hear from our Police Chief, Sean Barnes. Arielle?
Good afternoon. As the mayor mentioned, my name is Arielle Smith. I am the Director of Policy Planning and Evaluation with Public Health Madison and Dane County, and that division includes our Violence Prevention Unit. A public health approach to violence, we hear this term a lot, right? And what it means is it's a process that applies the scientific base of public health to violence as a community-based issue. And that is done through a 4-folded process: defining and monitoring the problem, identifying risk and protective factors of violence, developing and testing prevention strategies, and assuring widespread adoption. Today, I'm going to provide an update on just a handful of the strategies that we have developed and are currently testing through our implementation. As a part of our public health approach to violence framework, we developed the Roadmap to Reducing Violence. The roadmap was developed by Public Health with the help of numerous community leaders, stakeholders, and partners. The roadmap serves as the Violence Prevention Strategic Plan for Madison and Dane County. It also, it serves as the strategic plan for Madison and Dane County, and it includes 5 key goal areas, including data, fostering strong neighborhoods, supporting community engagement with children, youth, and families, bolstering and increasing intervention and continuous healing for those affected by violence, and strengthening community capacity, engagement, and coordination of violence prevention efforts. The Madison and Dane County Violence Prevention Coalition is a diverse group of stakeholders and community members who are interested and invested in reducing violence in our community. And those members work to carry out the strategies and activities that are listed and outlined in the Roadmap to Reducing Violence. So, through the efforts of the Violence Prevention Coalition, we've been able to put in funding opportunities, and so far have been able to invest over $300,000 back into our community through strategic partnerships that allow us to work on the strategies and activities that we know will reduce violence in our community. We have been able this year to fund Meadowwood Neighborhood Agency, the Dane County District Attorney's Office, and Operation Fresh Start for some of those initiatives. These have included the ability for us to support training and recruitment of community health workers, as well as host community events, such as dinners that support residents to increase resource sharing and community connections. We've also been able to support efforts that purchase and distribute new rapid response panic buttons for victims of violent crime who remain at risk for further perpetration of violence or victimization of violence, and also escalating violence. Lastly, we've also been able to support organizations that increase employment and workforce development for youth. We would like to thank those partners for the work and service they provide to our community, and we look forward to working with and funding additional partners to help advance our violence prevention work moving forward. The next initiative I'm going to speak about is the Isthmus Safety Initiative, also known as the ISI, and it is a project focused specifically in the downtown Madison area with a focus on reducing and deterring crime. This initiative has convened both a steering committee and an advisory committee in order to support the creation of strategies designed to prevent prevalent forms of violence in the downtown area. These strategies include safety navigators, which will be stationed in the downtown entertainment area in pairs, working with individuals, creating those community connections, and serving as a focused deterrent in the way of presence, meaning that they are there in order to be a safety navigator in the downtown area. The second strategy under this initiative is CPTED, also known as Crime Prevention Through Environmental Design. This strategy focuses on decreasing accessibility and improving lighting and surveillance in known areas in the community that could use some environmental design improvements. Lastly, we are also working on bystander intervention training for bartenders and bar staff. And we've partnered with an organization and are funding them to provide that training to bar staff to support de-escalation of aggression and intervention in cases of sexual predation and assault. Lastly, our Community Safety Intervention Team, also known as CSIT, is designed to share information regarding violent incidences through a multi-agency collaboration with the goal of stabilizing the communities involved and preventing further violence. While there are incidences that occur all across the spectrum of community violence, CSIT, in this particular function, with the support of the Violence Prevention Unit within Public Health, we only track certain violent incidences related to retaliation and other group violent occurrences. This year, CSIT has been referred over 135 cases to date. And of those cases, we've been able to review and strategize, discuss, and create action plans around 92 of them. With CSIT, we get a variety of cases that come into us, but attempted homicides, shots fired incidences, and homicides are discussed most often. These are just a snapshot of our current efforts directed towards reducing violence in our community and creating protective environments that prevent all forms of violence here. Thank you. Questions yet? After, thank you.
Good afternoon. My name is Che Stedman. I'm the Assistant Chief of Medical Affairs with the Madison Fire Department, and I have been in the position to oversee the implementation and operations of the city's crisis response team, or CARES team. We have just finished 1 year of operations, so I'd like to go through some of the data and some of the successes that we've seen this past year. So just to review, the goal of the CARES response is that when we send a paramedic from the fire department and a crisis worker from Journey Mental Health as first responders to 911 calls, it really is just about providing patients with help with their specific needs. We reduce patient contact with police and emergency rooms and get people the help in the community that hopefully they really need. And it really is all about connecting patients with additional support services. So just to talk through some of the expansions that we've gone over in the past year, we started out September 1st of 2021 with one team working 8 hours a day, Monday through Friday. By December of that year, we realized that we had the capacity to expand citywide, so we did, and we saw a significant increase in call volume for our responders. In July 25th of this year, we were able to put 2 full-time teams on the streets and have them in 2 different geographic locations, one at the City of Madison Fire Station number 3 on Willie Street, and the other location is the Old Town of Madison Fire Department on Fish Hatchery Road. Those teams are available for service from 8 a.m. to 8 p.m. Monday through Friday. So just to give an idea of what the call volume has looked like over time and with our expansions, we started out in that central district or downtown area of the City of Madison, which we saw from past police data was going to be the kind of busiest area of the City of Madison for behavioral health related emergencies. But since we opened up citywide and added a second team, we're averaging about 8.3 per call 8.3 calls per day that the team is actually in service. We're still not working weekends. We don't work holidays. We take some days off for training and other things. So when the team is in service, they are getting a good amount of calls. The key takeaways from that first year are the fact that we responded to 935 calls for service. And as of this date today, we have responded to 1,490. Each one of those calls averages about an hour, and the CARES has made contact in that first year with 724 individuals among the 935 total calls for service. A big piece for us to understand was the fact that we responded to about 57% of the estimated number of mental health calls and 9% of the daily average of check welfare, check person calls that occurred in Madison on those weekdays from 8 a.m. to 8 p.m. when the team was. And really most importantly is that only 3% of the CARES patients that we visited needed to be transferred to police. In other words, law enforcement needed to be called in because of protective custody issue or some other reason that law enforcement was needed. But it really does kind of show that we're meeting the objective of diverting patients from police and from hopefully emergency rooms and jails as well. We did transport about 18% of the 724 patients that we made contact with to emergency rooms. So our local emergency rooms are still a resource for us, but we're using those emergency rooms a lot less than we previously did, which again indicates that we're meeting the objective to divert patients from those emergency rooms where a lot of times that's not the best place for them to be. So the next expansion, we're hoping by the end of March 2023 to add one more of each specialty to our team. So one more community paramedic, one more crisis worker from Journey Mental Health so that we can cover weekend hours. The weekend hours are important to us. We know we haven't had services available. When we looked at Madison Police Department data over the 2018 to 2020 timeframe, during the week was the busiest time during the week for behavioral health related calls, but there certainly are calls like this on the weekends. And so now we're going to be able to cover 7 days a week from 8 a.m. to hopefully 8 p.m. And then the next expansion planned after that in the fourth quarter of 23 will be to hire one more of each of the specialties again to hopefully put a third team on the streets during the week, during the day, during the kind of the highest need for call volume. Thank you very much.
Good afternoon, everyone. My name is Sean Barnes. I'm the Chief of Police for the Madison Police Department. I want to thank the mayor for giving me the opportunity to share some of the results from our summer strategic plan. I want to thank Ms. Smith for all her work in public health, and of course, Assistant Chief Stedman for the work with the CARES unit. Our team certainly is appreciative of the collaborative effort. I want to talk a little bit about the 2022 Summer Strategic Plan. As many of you know, this is our second year doing a Summer Strategic Plan. This year, we expanded the time frame from June 1st through October 31st. This represents the time and period in our city where we see the most increase in violent crime and other forms of disorder. So we wanted to work strategically, and I want to share some of the results from that. We decided to focus on 2 particular crimes as well as 1 traffic focus. We focused on stolen autos and shots fired. The reason we did this is because both crimes show up on our data, on our qualitative surveys that we've been conducting in response to our strategic plan, our long-term 5-year strategic plan. Additionally, these are the things that our community is most concerned about. These are the things that people call about, that they talk to me about when we're in community meetings and other various forums. Stolen autos certainly represents a crime that affects an entire family and household when that happens. And shots fired, I believe, or violent crime is certainly related to fear of crime, which I want to talk about a little later on. We wanted to also have a traffic focus. As you know, we partner with the city with Vision Zero. And Vision Zero helped us to identify 3 particular areas of focus. Those areas are East Washington Avenue, Mineral Point Road, and the Beltline. Those particular areas represent where we thought we could have the biggest impact on reducing serious injuries and car crashes. Now, I must say we are still conducting traffic enforcement in your neighborhoods. We're still going to community meetings. We're still listening to things that you tell us, and we are certainly addressing those areas. But these were the areas that we focused on during our summer strategic plan. Just want to talk a little bit about our strategy and our focus and what I would consider would be the foundation of our approach to these crimes. This being the problem-oriented policing method, or the SARA method, where we scan for the underlying causes of crime and disorder. And in doing so, sometimes we find out that we do need our public health partners. We sometimes find out that there may be a mental health component to why we're seeing crime and disorder. And then we select the appropriate resource for that particular problem. We analyze and we use data. We use a data-informed approach, which we're very proud of. We respond to those particular issues. We create a response plan, and now we're in the assessment phase. So now that the summer strategic plan is over, I'm going to show you what the assessment showed, and we're constantly assessing throughout the entire period of this plan. Again, our goal in regards to this particular crime and this particular plan was to achieve a 15% reduction in stolen autos and shots fired. The gold standard, if you will, in policing is 10%. It's where criminologists tell us that anything above 10% is usually not due to chance, but to some intervention. I selected 15% because we always want to go above and beyond what the industry standard is. And to achieve this, we want to engage in what we call proactive crime reduction strategies, improve sustained departmental processes and procedures, and of course, acquisition of any needed equipment. In regards to traffic, we wanted to achieve a 15% reduction in injuries and accidents by focusing heavily on the areas that I mentioned before, East Washington Ave, the Beltline, and Mineral Point Road. Additionally, our strategy included creating better intelligence, human intelligence, collecting information from victims, determining where stolen cars may be left or where they may be taken from, looking at shell casings, looking at all the physical evidence that may be left after a crime, and also looking at our data. What is our data telling us about people who may be involved in crime? What is our data telling us about where or why people may be involved in crime? We wanted to improve our investigations. One of the changes that we made is that our burglary crimes unit is now the central hub for our stolen autos. And what that means is if someone is a victim of a stolen auto, you now have someone specifically assigned to return your vehicle and to determine how this happened and to prevent the next one. Training. Before we implemented the summer strategic plan in June, we trained the entire police department on what their role, what our expectation was, and how we were going to hold each other accountable. The word accountable in the police department means that we as leaders have to provide the appropriate tools, training, and time to get the work done. That's what we mean by accountability. Community outreach is very important to me and to our strategies because crime prevention is everyone's responsibility. The police cannot do it by ourselves. Although I believe we are the tip of the spear when it comes to crime reduction, we cannot do it alone. And of course, our criminal justice partner collaboration. We know about the criminal justice system. Cops, courts, and corrections is the easy way to remember it, but we cannot do that alone. So let's take a look at some of our results. In regards to stolen auto, during our summer strategic plan year to date, we achieved a 5% reduction in stolen autos compared to the same time last year. This is important because if you recall, we did not have a reduction in stolen autos for the summer strategic plan last year. So we really made some really good strides toward this particular crime. Something interesting from our analysis is that in July and August, 45% of stolen vehicles were either a Hyundai or a Kia brand. And so we really reached out not only to the community, but we had detectives reach out to Hyundai and Kia saying your cars have a defect. Are you going to do anything about it? And what they did was they partnered with us and they were able to give us some vehicle wheel locks, or commonly referred to as the club. We passed those out early August at our National Night Out and some other community events. And by October, only 9% of the stolen vehicles were Kia and Hyundai. And so that early intervention, that early check on what particular type of crime, what particular type of stolen property it is, really paid dividends there. I truly believe that if we were to aggregate this, if I were to show you these numbers without the Kia and Hyundai, we would have achieved our 15% reduction. But what we did have is a 270% increase from June through October in this brand. So this is why we decided to focus heavily on that, and we're able to receive a reduction in October. 28% of all stolen autos in this city were left unattended while running or had the keys inside. Now, I mention this because we need your help. As the weather gets colder, as people want to warm their vehicles to get the snow or the ice off, we remind you to not leave that vehicle unattended. We have a really nice video on our social media where we tell you, hey, take a blanket, a cup of coffee, or hot chocolate and sit in your car while it's warming up. These new cars really do not take a long time to warm up. So we want you to never leave your car unattended or never leave your keys inside your vehicle. We arrested 72 people during this time period for stolen car offenses, and that's a lot. So the officers are really going out and they're doing the work that we need to do. We're returning vehicles to people and we're making sure that people are being held accountable. 12% of those were arrested more than once for stealing cars. And so we did have a small group that were repeat offenders. And these are the ones that we know about. These are the cars that we were able to apprehend them and hold them accountable for. So we need your help as a community. We need your help to talk to your friends, neighbors, and loved ones to make sure that everyone, of course, is on their best behavior. 38% of the arrests for stolen cars were people under the age of 18. I've spoken extensively about my need or my goal, my wish for the police to be more involved in community engagement. And through the generosity of our city council, we'll be able to do that with a grant that we received this year. We'll add 6 officers specifically for youth engagement, which is very important and near and dear to my heart. Why did we do this? Why are we dedicating this amount of resources? It's because we care. We care about young people who may be in stolen cars, as the data shows. We care about young people who may not have the capacity to operate a vehicle at a high rate of speed. We care about individuals who are young, sometimes under the age of 16, who may be in an accident. It's very important to us. And so we hope to get that program up and running very soon and to begin to interact in a positive way with our kids so that this number of 38% is reduced next year. Let's take a look at shots fired. The goal was to reduce shots fired by 15% year to date during this time. We currently have a 21% reduction in the number of shots fired compared to the same time last year. And so I really believe the strategy is working. We're looking at those shell casings. We're trying to match persons who are essentially using weapons for whatever purpose, and we're making sure that we're in the right place at the right time. We had a 25% reduction from the 5-year average. So when I saw this number, I said, okay, 21%, excuse me. I saw this number and I said, well, I'm thinking about it. And I said, well, that's year to date. It could have been something going on. Can you show me a larger data set? And the numbers came back and confirmed that we are headed in the right direction, a 21% reduction from the 5-year average. More importantly, we had a 21% fewer people who were struck by gunfire. And that's very important because, as the mayor mentioned, post-COVID, we have seen violence increasing throughout our country. And it is certainly not a victory lap, but it's important to note that these numbers are reducing here in the city of Madison. And so the number of people who are struck by gunfire has been reduced. Because we're doing the work, 168 firearms were seized as evidence of crime from June through October. And in case you're wondering, that is a lot. That is a lot of firearms that were associated with some type of crime that was taken lawfully. It's important to note also that these firearms are being seized in a way that's constitutional, in a way that's procedurally just, and we do not have the uses of forces that you have seen in some cities while trying to combat this crime, and I'm very proud of that. We had no shots fired hotspots. So a hotspot is when an area has a repetitive amount of crime. It's a term that we actually got from the fire department. And so our threshold for shots fired was 4 incidents within 10 days within a half-a-mile radius of each other. And we didn't have that. One reason is because our commanders were currently searching, looking for information daily. Our crime analysis section was sending information to the districts daily, hoping to get good information, and then we could have some interceding there if we needed. But we did not have any hot spots. Let me go back just one minute because I want to mention something that I put in my notes. These are just statistics, right? And they show that we're certainly trending in the right direction. But I know for a lot of people, it may not feel that way. And for me, I want you to know before I go any further that fear of crime is very real. And when you hear about someone who's been struck by gunfire, when you hear about a homicide in our city, these numbers don't seem real to you. And I want you to know that we try to be as transparent as we can. We put our blogs out. We put every crime or every incident that happens in the city. And I don't want to sacrifice transparency for fear of crime. But I do want to tell our community that we do have a safe city. We're trending in the right direction. We're working collaboratively, and we are certainly focused on reducing violent crime and returning the city to the city that we all remember. Take a look at traffic injuries in the areas that I mentioned. We wanted to get a 15% reduction in injury on these particular corridors. The results are that the Beltline, we had a 29% reduction in injuries during this time period. On East Wash, we had an 8.5% reduction in serious injuries. And on Mineral Point Road, we had a 41.7% reduction. Now, I have to say it again, we're still doing traffic enforcement in your neighborhoods. Maybe not as often as you want, because we can't be everywhere all the time, but the officers are certainly focused on this particular crime. Here are some numbers. Citations on the Beltline during this summer strategic plan, 638 citations. On East Wash, 766. On Mineral Point Road, 153. And we're issuing warnings as well, not just citations. On the Beltline, 517. On East Wash, 721. And on Mineral Point Road, 130. So the officers and staff are out there. They're doing a tremendous amount of work. And again, we're still doing work in your neighborhoods. We're still answering calls for service, and we're still servicing our community. So going forward, we're focusing on intelligence, being quicker, being faster with those intelligence, making sure that our reports are done quickly, and making sure that the decision makers have the information that they need when they need it. We're still looking at our investigations. We will keep our burglary crime unit as a central hub for stolen autos because we believe that it's working. And we will still continue partnering with Vision Zero. That's something that's very, very important to us, very important part of the Team City approach. And then finally, I just want to thank our community, which includes our police department, which includes our fire department, which includes public health, for working together and making this year a successful year for our summer strategic plan. We're in the assessment phase now. We're looking at what we need more of or less of, or how we can get quicker information. And we'll be back again, obviously, next summer with another summer strategic plan, hoping to make, again, Madison the safest city in America. Thank you.
Thank you, Chiefs, plural, and Ariel. Really appreciate that information. And I want to add my thanks to the Chiefs as well for this Team City approach. I'm really pleased to see that the incidents that are being reported and discussed at the Violence Prevention Unit are trending downward. I'm very happy with the results of the CARES end-of-year report. And as you heard today, the CARES teams have gone on even more calls than you saw in the slides. I think it was 1,490 as of today across our entire community. I think that's really remarkable. And as you saw, we did provide funding in the 2023 budget, and I want to thank the Council for that, to expand CARES to weekends and then to a third location over the course of next year. And I'm really pleased, and I want to thank Chief Barnes for his strategic plan approach to see the good news that is coming out of MPD. The fact that shots fired are down 21% over the same time period last year is not an accident. It's a result of a lot of hard work by the Madison Police Department. The fact that fewer people are being hit by bullets in our community is a result of good, hard work by city staff. And I want to thank all of them and to thank our community as well for believing in this approach to violence prevention and reduction. So thank you all for your tireless work and leadership in the public safety space. The City of Madison is going to continue our efforts to build a safer community, to build healthier neighborhoods, and to create opportunities for young people in Madison, because we believe in taking a comprehensive, evidence-based public health approach to violence reduction and violence prevention. We have to continue to look at the entire landscape of public safety here in Madison and work together to make Madison a safe and a welcoming place for everyone. So thank you all for tuning in, and we will see if we have questions from the media site.
We have one question. Are there any plans to eventually expand CARES teams to include overnight/nighttime hours?
Chief?
Yes, so expanding to evening or overnight hours is definitely part of our vision. As I mentioned, we looked at 2 years worth of Madison Police Department data from 2018 to 2020, and the overnight hours were clearly the lowest time for call volume. The other thing is that while Dane County is very social service rich, not a lot of those services are open overnight, so it reduces the ability for our crisis response team to refer people to services and actively do warm handoffs with services overnight. I can say that the Executive Parisi, Dane County Executive Parisi's office is working on a 24/7 mental health triage center, and we hope that in concert with that, we can possibly cover overnight hours. But we're just really driven by the data, driven when the highest call volumes are, and so it's coming. We just don't know exactly when.
I would just add that, as the chief said, we really are driven by the data here, and I think that there's, we'll be expanding twice in the coming year. I think we'll continue to look at what's happening in the trends for calls and the types of calls. I think that the overnight hours are one potential expansion. I think there's an opportunity to have conversations with surrounding communities about their desire to participate in this program. And I think there's an opportunity to look at the types of calls that are being dispatched to the CARES van. And see if we can expand in that direction as well. All of that is going to take a lot of data analysis and a lot of conversation over the next year. But I'm hopeful that by the time we're putting together the 2024 budget, that we will be in a position to know what kind of investments we need to make to further expand CARES. Any other questions?
None at this time.
All right. Thank you all so much for tuning in, and thanks again to the folks that presented all this great information today. Have a great day.